Hey everyone, welcome to the Life and Style podcast where we explore health, wellness, and issues that truly shape our lives. I'm Shahira, your host for this episode, and today is actually World Rare Disease Day with its theme of more than you can imagine. So, in honor of that, we'll be shining light on rare kidney diseases, conditions that are often misunderstood, misdiagnosed, and often overlooked. For the 300 million people worldwide living with rare diseases, the journey to diagnosis and treatment is rarely straightforward. Many face delays in getting the right answers due to a lack of scientific knowledge or even limited access to quality healthcare. I want to dive deeper into this, and of course, I'm not alone. I'll be speaking to leading doctors and experts in this field to learn more and understand better so that we can all educate ourselves on rare kidney diseases because awareness is always the first step to change. So, joining with me are two very special, distinguished experts. I'm going to start with Dr. Rosnawati Yahya. She's a nephrologist at Sunway Medical Center and the vice president of the Malaysian Society of Nephrology, MSN. And she's widely respected in both Malaysia and internationally in her expertise in chronic kidney disease and rare kidney disorders, actively contributing to research, registries, and clinical trials. Hi, doctor. Welcome to the podcast. Hello. How are you?
I'm
Okay.
very good, thank
All
you.
right. Thank you
Thank
so
you
much
for
for
having
joining
me.
us. Okay. We also have Professor Dr. Bradley P Dixon. He's a renowned pediatric nephrologist from the University of Colorado School of Medicine, all the way from the United States. He's an expert in kidney disorders that have abnormalities affecting the immune system, including rare diseases like AHUS, or the long name is atypical hemolytic uremic syndrome. I hope I said that correctly. Dr. Dixon is also actively involved in research, particularly wide variety of kidney diseases that have a genetic cause. Hi, Dr. Dixon.
Hello, thank
How are
you for
you?
having me. I'm well.
Thank you so much, both of you, for joining us on this podcast. It's lovely to have you here. Okay, I'm going to just jump right in. Maybe, Dr. Rosna, we can start with you. You can share with us and the audience what is defined as a rare disease?
A rare disease is defined as a condition that affects a small percentage of the populations. The exact definitions varies between countries. For example, in the United States, a rare disease is defined as a disease that affects fewer than 200,000 people in the United States. However, in Europe, a disease is considered rare if they affect fewer than 1 in 2,000 individuals in their populations. The World Health Organization has not defined rare disease generally. In Malaysia, we do not have an official definition of rare disease. However, according to the Malaysian Rare Disorder Society, MRDS, a rare disease is defined as disease that affect less than 1 in 4,000 individual in Malaysia. And despite their rarity, there are over 7,000 known rare disease collectively affecting around 300 million people in the world.
Right. Okay. Thank you for that. Dr. Dixon, I wanna ask, in Malaysia specifically, when you mention about kidney diseases, diabetes or high blood pressure, are known as the main culprits. But what exactly are rare kidney diseases, and could you give some examples and how it's different from common kidney diseases?
Sure.
Yep.
So, rare kidney diseases would be a part of that 7,000 diseases collectively. And some examples of rare kidney diseases would include IgA nephropathy, Alport syndrome, C3 glomerulopathy, and atypical HUS, to name a few.
Okay, so that's just a few out of many others. Okay, but Dr. Rosna, do rare kidney diseases, often get misdiagnosed? Maybe you could share.
Right. I think yes, rare diseases are often misdiagnosed for several reasons. The first reason is probably lack of awareness among healthcare practitioners. Some of us are actually very much have limited experience with rare diseases because they only affect small percentage of individual. And some conditions may mimic more common conditions, leading to incorrect diagnosis at the beginning of their disease. And many of these disease, they have non-specific symptoms. And some of the symptoms very much like the common kidney diseases. Therefore, they often misdiagnose or late diagnosis. And the third reason are basically limited diagnostic tool. The reason I said that is a lot of these diseases are probably genetically related. And we know genetic or specialized testing may not be readily available in our clinical setting. And and some of these diseases, they can be present for quite some time before the healthcare practitioner is actually able to make a definitive diagnosis. And most of the time, these patients have gone to see several healthcare practitioners before the diagnosis is actually made.
Okay.
And of course, the last reason is because they are lacking research data on these diseases. They are not as well studied compared to common diseases
Okay.
that we see.
Okay.
Yeah.
So when you say like they only discover it at a later stage, is that at a stage where it's like life-threatening already? Or
Yes, Professor Dixon mentioned about IgA nephropathy. Many of these patients actually detected much earlier. For example, when they go for health medical checkup, pre-employment or pre-entry to university, they are detected to have protein and blood in the urine, and frequent these findings are ignored by the primary healthcare practitioner, and they can progress over the next few years. And by the time they actually present to the nephrologist, they are almost at the verge of starting dialysis because of unawareness of the significance of protein and blood in the urine.
right. So it's the unawareness comes from both sides, right? The
It
patient
can-
and all the healthcare professionals.
Yes.
Okay, okay. Dr. Dixon, maybe you could share with us, are rare kidney diseases limited to specific demographics, or can they affect anyone regardless of age, ethnicity, or even lifestyle?
It can definitely depend on the rare kidney disease in question. Many rare kidney diseases affect individuals of both sexes and all ethnicities, but some are more common in certain ethnicities than others.
Okay. Maybe you could share an example of that?
So one example is that IgA nephropathy, for example, is particularly common in individuals from Asian countries.
Oh, okay. Oh, Asian countries.
It probably has to do with an environmental exposure, but also genetic differences between individuals of Asian background and other ethnicities.
I see. When we talk about age, does it appear a lot in children?
IgA nephropathy specifically can be seen in children. What we know of many rare diseases and rare kidney diseases is that 72% of rare diseases have a genetic cause. And so many genetic diseases can be identified earlier in children because of how quickly it can present.
I see. Okay. All right. Um, uh, the sorry, I had to add one question before I go to Dr. Hasna. What about the treatment wise for children? Is it any different for adults?
Again, that depends on the rare kidney
Okay.
disease in question. Only about over 90% of rare diseases, and that includes rare kidney diseases, have a defined treatment.
Right. Okay. All right. Great. Okay, Dr. Hasna. Maybe you could share with us what is the prevalence of rare kidney disease in Malaysia itself?
Right. It depends on the type of the rare kidney diseases. Some data are actually available in our, for example, Malaysia have our own renal biopsy registry.
Okay.
So I can quote some figure. For example, for lupus nephritis, we see roughly about 500 to 700 new cases every year. For diseases like IgA nephropathy, we roughly have about 200 cases being reported each year.
Sure.
And rarer diseases like atypical HUS, C3 glomerulopathy, those are even rarer, and we may not even be able to capture it. For example, we don't have registry specific for atypical HUS. We do have registry for renal biopsy. So these are the diseases, kidney diseases that are rare but are diagnosed through kidney biopsy. So the reason we capture them is because every single biopsy that the clinician performed, regardless where you are working, you are supposed to register it through this registry. So we do have some data on these diseases. Diseases like congenital abnormality of the urinary tract or Charcot, we don't have the registry for that. Autosomal dominant polycystic kidney disease. We do know how many people starting on dialysis due to that disease, but we are not able to capture how many family members are affected because ADPKD or autosomal dominant polycystic kidney is a autosomal dominant
Okay.
disease. What that means is if your parents are affected, your chance to get the disease is practically high, about 50%. But we do capture who started on dialysis, but we do not know who else are affected that have not yet started dialysis
In the family.
in the family.
Okay. So that's about Malaysia. What about for the US, Dr. Dixon? What's the prevalence of rare kidney diseases there? And is the diagnosis in US more robust and easier to identify?
It depends on the rare kidney disease. There are some rare kidney diseases like atypical HUS where it occurs in about 1 in 1 million individuals, so quite rare. Autosomal dominant polycystic kidney disease is also seen in the U.S. population, and it's much more common around 1 in 1,000 individuals.
1 to 1,000 individuals. What about the treatment? I mean, the managing of is there?
And to come back to your earlier question, the recognition of these diseases will depend often on a clinician, a healthcare provider to put the answer together to recognize the signs of those diseases. And I think the U.S. is no different than Malaysia in that sometimes it can take multiple providers to find that answer.
Right. Okay. All right. In terms of, I mean, I asked you about managing just now, but I mean, the challenges of managing these rare kidney diseases in both countries, maybe Dr. Rosna can go first.
I mean, we actually face a lot of challenges in managing rare kidney diseases. Number one is, like as I mentioned, diagnostic challenge is a big problem, and we have very limited number of nephrologists in the country. In Malaysia, for a population of 34 million, we only have less than 300 nephrologists in the year 2024, and that is basically a ratio of 8.8 nephrologists per million population, or one nephrologist for 113,000 people in Malaysia.
Yeah.
So very, very small number of nephrologists. And chronic kidney disease, for example, is very common in Malaysia. It is estimated that 3.8 million Malaysians actually suffer from chronic kidney disease due to common kidney disease such as diabetes, hypertension, so on and so forth. And currently, as of 2023, we have more than 52,000 end-stage kidney disease individual. So you can imagine that the ratio nephrologist to a patient with kidney disease is actually very, very high. So the doctors are basically bogged down with a lot of works to deal with common kidney diseases.
Okay.
And as I mentioned, diagnostic challenges. Genetic testing is still very much limited in Malaysia, and most of genetic testing we actually have to send across the world, either to United Kingdom or United States.
Right.
So diagnostic challenges. And of course, the next thing would be access to treatment, right? Treatment for rare kidney disease are generally much more expensive compared to treatment for common kidney diseases. And our government probably spend much more money focusing on common kidney diseases rather than rare kidney diseases. And a lot of this treatment is not accessible to our patients, right?
Okay. So, you mentioned just now we have a lack of nephrologists in the country. Why do you think so? Why do you think it's such a small number?
Oh, that's gonna take give me 2 hours to answer the question. That's a lot of factors.
Okay.
That's a lot of factors. Yeah.
What about Dr. Dixon? Maybe we can elaborate more about managing rare kidney disease in the U.S. The challenges that come with it.
Some of the challenges we face are similar to what my colleague faces here in Malaysia. That access to treatment is, depending on the treatment, certainly better in some cases in the United States, but it's often very difficult because those treatments are quite expensive. They're only developed for a small number of people, and so often those treatments are quite expensive as a result, and that can create challenges with the healthcare economics of those treatments.
See. Okay. But that's talking about managing rare kidney disease from the healthcare point of view. What about the patient itself? What are the challenges that they go through in managing this rare kidney disease? Maybe doctor can go first.
Sure.
Where's that?
Certainly, at least in my experience, the patients with rare diseases and rare kidney diseases that I take care of often are their own experts. They know often more about their rare kidney disease than many healthcare providers, including their primary care provider that they have a relationship with. And so it's difficult for a patient to advocate if their healthcare provider doesn't really understand the condition or is unfamiliar with the condition.
Okay. Well, and what about you, doctors? Maybe you can share. Well,
In terms of treatment,
I mean, when a patient itself managing the rare kidney disease, what are the challenges that they might go through? They might face.
a lot of patients actually express that they do not have access to information.
Okay.
Mm.
Some do have do make their own research and find out. For example, a few patients actually comes and see me because they have heard about the center that I used to work at conducting a lot of clinical trials. So she wanted to get onto the medications that is currently on being investigated of its efficacy. She doesn't want to take steroid, for example, right? I have a patient with IgA nephropathy. She overheard through the grapevine among people that she come and see me. She said, Dr. Rosna, I do not want to take steroid. I have read about all the side effects of chronic corticosteroid therapy. What are my options?
Okay.
Right? And so I explained to her they are FDA approved treatment that is available, but that's not in the country, which costs this much this month, and you can access in Singapore. That's one option.
Right.
The second option is if you are interested to take part in a clinical trials, I can refer you to a colleague that are currently conducting the clinical trial in another institution.
I see.
Something like that, yeah.
Okay. Okay. And I just want to jump onto that. What about maybe the challenges of their caregivers, the family members? What might challenges that they might face? Could you share on that?
Um, because many of these diseases require a specialized center for treatment or for care. Those specialized centers, I'm sure in Malaysia, just like in the U.S., are in very specific locations. And so families may have to travel great distances to a specialized healthcare center where there's familiarity with and expertise in these conditions.
I see. I see. Is it about the same?
Yeah, it
for
is about the
patients?
same in Malaysia. We have patients as far as East Malaysia, which is Sabah and Sarawak. They have failed most of medical therapy, And we wanted to offer them to go into a clinical trial, but they have difficulty to travel all the way. And if the patient who are affected by this disease are young, their parents actually go through a lot of anxiety, worrying about what will happen to my child in the future. I have an 18 years old daughter, been diagnosed at IgA nephropathy at this age, and what are her chances to develop kidney failure in 10, 20 years' time? So it can be very, very stressful for the family.
Okay, okay. I know we talked about earlier how correct me if I'm wrong, how rare kidney disease is mostly genetic. Is that correct? But actually, maybe you can share what are other causes of rare kidney diseases. Maybe Doctor, you want to go first?
Sure. In the smaller percentage of rare kidney diseases that don't have a genetic cause, many of those have an autoimmune cause where the immune system becomes directed against a person's own tissues. And so one example of that may be IgA nephropathy, and that there is an autoimmune portion of that disease. Another example would be lupus nephritis, as Dr. Rosna was mentioning, that it's an autoimmune phenomenon as well.
Okay, okay, okay. Thank you for that. I want to ask the both of you. With the advancement in AI in healthcare, do you see a future where rare kidney diseases can be detected earlier? Dr. Rosna, maybe you can share your thoughts.
Um, I think the answer to that would be yes. AI is not taking over the world, I would have said, right? For example, AI in medical imaging, right? Maybe AI can analyze the kidney ultrasound, CT scan, MRI, and actually put all the informations together and may able to pick up certain findings that our normal eyes cannot. And maybe AI can do the same thing on renal pathology. They may be able to pick up subtle signs that our normal eyes cannot pick up,
Right. Okay.
right?
Maybe
I can think of some. And maybe you can put some more clinical informations together and make each patient, and personalize their treatment in the future.
Mhm.
you
I would
agree
agree with
Arvin,
that.
on
I
that.
think AI is very good at pattern recognition. And so a clinician being able to use tools to help them identify a pattern of disease may come to an earlier diagnosis, or, as Dr. Rosna was saying, can personalize the treatment approach.
Dr. Rosna, I want to ask you, when it comes to the initiatives of Malaysian Society of Nephrology, what are the initiatives taken to advocate for rare kidney disease? Maybe you can share more on that.
Okay, there have been group of nephrologists that actually has come together, and we have been talking about developing Malaysian rare kidney disease registry. As I mentioned just now, some of the uh, rare kidney disease that is biopsy proven is currently already captured under Malaysian Registry of Renal Biopsy. That registry has been established since the year 2005, and we've collected thousands of data and has been a source of identifying patients who will be benefited from clinical trials. So in Malaysia, we are actually taking part in a lot of industry sponsored clinical trial to look for treatment, for example, IgA nephropathy, lupus nephritis, focal segmental glomerulosclerosis, so on and so forth. So that is one part of the registry that is already established. The other registry that we want to develop are those that does not require kidney biopsy for diagnosis. For example, autosomal dominant polycystic kidney disease, atypical HUS, they rarely get biopsied, and congenital diseases among young children, like what we call chakut, is a congenital diseases where the children actually born with these abnormalities. So we don't have the registry for those, so we are in the midst of developing it. The other initiative that Malaysian Society of Nephrology is currently in planning is that we are at initial phase of discussion with the National Kidney Foundation of Malaysia. As you know, National Kidney Foundation has been advocating for patients with end-stage kidney disease, assisting them in obtaining hemodialysis, peritoneal dialysis, kidney transplantation, so on and so forth. But we are hoping that National Kidney Foundation will take the lead together with MSN to develop advocacy group for patients with kidney disease.
Wow. Okay. Thank you so much, doctor. What about Dr. Dixon, maybe you can elaborate in the US what kind of initiatives are being undertaken by, policymakers, patient advocacy groups, and the healthcare ecosystem for rare kidney diseases.
The American Society of Nephrology, along with the American Society of Pediatric Nephrology, and National Kidney Foundation have developed what's called the Kidney Health Initiative. So it's a large collective of professional organizations and policymakers to advance the agenda of kidney disease in public finance and public policy. The U.S., as well as many other countries, participate in many global registries, AHUS being one of them, where providers from multiple countries can contribute their patients to these registries. And ultimately, the more we know about a particular rare disease, the more we can understand its variability, but also understand how some patients may benefit from a treatment more than others.
Oh, okay, I see. I want to also ask both of you, what do you think can be improved to better manage rare kidney diseases worldwide? Maybe you can go first.
Sure. I think earlier recognition is perhaps the most important, and that comes with awareness and familiarity with the diseases. But the earlier we recognize these diseases and the earlier we can institute a specific treatment where treatment is available, will ultimately lead to better outcomes for our patients.
Okay. What about Dr. Rosna?
I entirely agree with Professor Dixon.
Okay.
Earlier recognition,
Okay.
earlier treatment, whatever we can access to. Some of the treatment, like Prof. Dixon mentioned, is probably difficult to access to. But earlier recognition, and early treatment.
Okay.
Yeah.
So it needs collaborative support for that, you think? Yeah. Okay. Okay, before we get to the end, I want to ask, why, as healthcare professionals, why is it important for all of us to pay attention and to care about rare disease and rare kidney disease? Maybe Dr. Rosna can go first.
The first thing I think we need to first acknowledge that rare kidney disease is more common than we think. So there's quite a lot of patients actually suffering from these diseases. Number one. Number two is, as mentioned, a lot of them are genetic and inherited. So family screening, family history is very important. So we can identify affected individual in the family that we can actually offer early diagnosis and early treatment. And we know delayed diagnosis is a major issue. I've mentioned just now, for example, patient with IgA nephropathy, where many interventions can actually delay the progression to end-stage kidney failure. And of course, limited treatment option and high cost. So the least that I think healthcare professional can do is recognize these patients and try to get them very much into the clinical trial, so they actually can access the therapy much earlier before the treatment is actually approved by FDA. Any treatment in the world, if FDA approved it today, by the time the treatment actually gets to Malaysia, will be another 3 to 4 years time. And that's a delay for the patients, a significant delay for the patients, and cost. So we need probably to, in the future, advocating to support the treatment for this patient.
Yes, and I would say that the patients ultimately bear the brunt of that limited access to treatment. And I think patients who have a rare disease, a rare kidney disease among them, often feel quite isolated. And so it's important for healthcare providers and families to um, ensure that there are ensure that there are communities for these different rare diseases that patients can connect with one another and advocate for themselves.
Okay. Do you, maybe since it's World Rare Disease Day, any messages at all you want to share to our audience? Yes. Yep.
For those of you with a rare disease or a rare kidney disease, you're not alone.
Dr. Rosna, maybe you can share something if we're.
Yes, if you suffer from any rare disease or rare kidney disease, don't feel isolated. Reach out to professional societies, reach out to patient support group, and I'm sure there are some areas where we can actually assist you with.
All right, amazing. Thank you so much, Dr. Dixon, Dr. Rusna. It's been a pleasure having you on the podcast. Thank you for helping us better understand about rare kidney diseases, and I hope that we can all learn something from this. And so that brings us to the end of this episode. I hope that you now understand why awareness on rare kidney disease is so important. But before that, I just want to share that in an earlier episode for the Life and Style podcast, we also dive deep into the complexities of a rare kidney disease, as mentioned by both doctors just now, which is called atypical hemolytic uremic syndrome, AHUS. I spoke to another two renowned experts, and we discussed on its diagnosis, the treatment challenges, and more. So be sure to check that out on CNR Daily's social media platforms as well as the website. So don't forget to like, follow, and subscribe to all of our social media platforms. For the latest news, head to www.sinadaily.my or download the app for news on the go. Thank you so much for tuning in. I'll catch you soon.